All right. Welcome, everyone. We're going to get started. For those that I don't know, I'm Debbie Feldman, and I have the privilege of being the CEO here at Dayton Children's. And we are here in our recently completed Specialty Care Center, not fully completed, as you can see, to celebrate another milestone, another step in Dayton Children's journey to achieve our mission of the relentless pursuit of optimal health for every child within our reach. And we could not be more thrilled to be here breaking ground, at least euphemistically breaking ground, because you can't see, but you'll see soon. The ground has already actually been broken on our new mental health building. So we're here today because we felt for a problem as complex and as challenging as behavioral health, as the mental health of our children, we need a bird's eye view. And that's what we're going to try to do today. Mental health is truly the health crisis of this children's generation. And it does require that 50,000-foot view to understand what it's going to take to understand it and then help address it. We've been working for almost 11 years now, trying to add services and plug the holes in the pediatric mental health landscape. And yet there are still gaps. So this building, this will allow us then to bring together a number of those services, as well as add community-based services to try to bridge those gaps, because not one child can fall through the cracks of care. We absolutely need to have those services for every one of them. We have a lot of members of our mental health team here today, and the impact on them of this crisis really cannot be understated. So we want to share with you a short video of the experience that our Associate Chief Medical Officer for Behavioral Health, Dr. Kelly Blankenship, recently experienced.
The number one reason any child actually is admitted to Dayton Children's is thoughts of wanting to kill themselves. And so there was one child in particular that I can think of that they came in after overdosing on medication and came to the unit. And during my interview with the patient, we discussed, what triggered the overdose? What made you feel like life was not worth living, that you would be better off dead? And they even talked about some bullying at school and then some over social media. They talked about some difficulties at home, and then during the interview started crying. And when I asked them why they were crying, they said they were crying because they were still alive. They wanted to be dead, and that they just couldn't believe that suicide attempt didn't work. This is the crisis that our generation of kids is going to be facing. And it takes all of us working together as a community to really solve this and find the right answers.
It's really devastating. I'm going to ask Dr. Blankenship to come up in a moment and share with you the current state of the situation here at Dayton Children's. Before I do, I want to recognize some special guests that are here in the audience today. Certainly, Governor Mike DeWine and Mrs. DeWine, we are so thrilled that they have been able to join us. Director Lori Chris from the Department of Mental Health and Addiction Services. Lori, thank you so much for being here. And a number of our state legislators who support us in so many ways. Senator Steve Huffman, State Senator Niraj Atani, State Representative Phil Plummer, State Representative Andrea White, State Representative Willis Blackshear. We also have representative from our congressional office, Garrett Arnold from Senator Vance's office, Joe Braden from the Ohio Auditor's office, and then locally, our Montgomery County Commissioner Judy Dodge, and Peggy Lehner, our mayor of Kettering, and of course, a member of the Dayton Children's Foundation Board. I hope I haven't forgotten anyone, and with that, I'd like Dr. Blankenship to come up and share some words.
Thank you, Debbie. So that patient history that we just heard about, we hear that every day here at Dayton Children's. And what's really scary is how common that story is becoming. As Debbie said, we are trying to bridge the gap in care. So if you take a look at the children on our bridge, they will share some really startling statistics with you. So if everybody can look at the 7,000, the child holding the sign that says 7,000, there were 7,000 children that came to our ED or our crisis center last year because of a mental health crisis. And just to help you put that number into perspective, if you think about Centerville City Schools, There are 7,000 kids enrolled between kindergarten and senior year. Think of all those kids. That's approximately 7,000. 7,000 kids coming to our ED or our crisis center because they are in a mental health crisis. And on average, it takes 5 weeks to get a child an intake with a therapist. 5 weeks. And if the child is younger than 10 or has really complex needs, it can take even longer. And there's waits to get into an inpatient behavioral health unit too. So here at Dayton Children's, we have a 181 bed hospital. 24 of those beds are dedicated to behavioral health, but those beds are almost always full. So when a child comes in to our ED in a mental health crisis, when a child comes in saying that their life is not worth living anymore, that they want to be dead, and that they cannot go home because they're afraid they're gonna hurt themselves, then we try to admit that child to our behavioral health unit. But like I said, our unit is almost always full. So then we call all of the behavioral health units that take youth in Ohio and try to get them into a behavioral health bed somewhere in the state of Ohio. But those beds are almost always full too. So when that happens, we admit the child to our medical floor where somebody sits with them to make sure they stay safe until a bed somewhere in Ohio opens up. In the month of March, we had 211 kids waiting in a medical bed to get into a behavioral health unit. 211 kids. That number is up 31% from March of last year. These numbers are so scary and they are increasing so quickly. And what's worse is once a kid does get into our behavioral health unit and they start doing better and we discharge them home and they're on the path to recovery, there are so few outpatient therapy services and intensive therapy in the community that 1 in 12 will come back within 30 days to be readmitted. But there is some good news. As Debbie said, we've been working hard over these 11 years. And we are beginning to see that what we are doing is making an impact. 2.5 years ago, we opened our partial hospitalization program in intensive outpatient services. So that's a step down from our inpatient unit. So kids, after they've been discharged from our behavioral health unit, can come to our partial hospitalization program. That is a program where kids go to therapy from 8 to 2:30 every day, go home at night. And they do this Monday through Friday for about 2 to 3 weeks, and then they can step down into our intensive outpatient program. Our intensive outpatient program is about 2 to 3 hours of therapy, 3 afternoons a week, and they can stay in this for about 4 to 6 weeks. When we look at the statistics, they're less likely to need to be readmitted to our behavioral health unit. And that same program was just named the best in the country for partial hospitalization programs by the Association for Ambulatory Behavioral Health Care for the quality of care and the results that program is able to deliver. Thank you. We are really, really proud of our staff and the people that run that program. But I do have to say, the true honor is seeing kids who were so sad remember how to smile and laugh again. I'd like to invite Harper Magis up to speak so that she can share her experiences and her perspective with you. Harper is a senior at Kettering High School and one of the very first members of the Hope Squad there. Harper?
Hello, my name is Harper Magis. I'm a senior at Kettering Fairmont High School, a 4-year Hope Squad member, and this year's Hope Squad director. Hope Squad is a peer-to-peer mental health and suicide prevention organization. The mission of Hope Squad is to reduce youth suicide through education, training, and peer intervention. As a member of Hope Squad, I have learned to talk, and even more importantly, how to listen to all those around me. Sometimes what I hear can be terrifying. Freshman year, I found one of my friends breaking down in the bathroom. When I asked her what was wrong, I was not expecting her to say, "I just want to die. I can't be here anymore." Junior year, I was pretty close friends with an underclassman. He went through a really tough breakup. I was there for him. Night and day, I supported his needs. I was up at 3 in the morning on a school night, receiving texts like, "I just can't imagine living without her," and "since I don't have her, there's no point in being here at all." Just recently, I dealt with a really tough situation. I have a friend in my history class. We're the type of friends who talk a lot at school, but aren't extremely close. One night, she texted me saying, "Harper, I need help." Now, when I read this text, I was expecting it to be her asking for help about an assignment or asking a question about the class. I was not prepared when I received the next text that said, "I can't do this anymore. I have a bottle of pills next to me, and I want to go to sleep and never wake up." No matter how many times I deal with scenarios, sometimes you cannot be prepared for what people will say to you. While helping this individual through a crisis, she said something that reminded me why I am so passionate about this cause. She said to me, "I'm not supposed to feel like this. I'm not the type of person who does this." This is what the mental health stigma does to youth. Makes them believe they're not allowed to struggle and ask for help. We cannot continue to let our peers, friends, and kids feel this way. Everyone has their own struggles. As involved as I am with advocating for mental health awareness, even I struggle. I always struggle to talk about my adversity because I have been so fortunate in life. I have a loving family, great friends, and adults who surround me with constant support. But I'm still allowed to feel my feelings and go through rough times. I had an extremely difficult start to my senior year. I was overwhelmed by my rigorous class schedule, college applications, and my relationships. My long-term relationship ended suddenly and everything seemed to go downhill. I was trying to keep up with all my commitment while not being in the best headspace. I wasn't sleeping well, wasn't attentive at school, and cut people out as much as I could without appearing concerning. I was trying to brave my way through a time when I completely wasn't okay. I felt too much pressure to be okay and continue to be the supportive, positive person I am. I focused too much on helping others get through their struggles versus helping myself to get through my own. An adult in my life helped me to realize that to be the help I want to be for others, I need to first care for myself. I needed to prioritize my own mental health. I had to realize it was okay for me to struggle, and it was okay for people to see me struggling. It was perfectly fine that I needed help. Now I use what I learned to help others. I have brought some of my Hope Squad members along with me today. They are wearing their Hope Squad shirts. Please feel free to ask them questions about their own Hope Squad experience. I'm so thankful that Dayton Children's is leading the charge in our community to not only care for children in crisis, but to encourage families to talk about mental health. It takes a village. We can't solve this problem without all of us dedicating our support. So today, I ask you to join me in pledging your support to mental health so that every child, every student like me, can thrive. Thank you.
Thank you, Harper. You continue to remind me why we have to listen more to our kids and talk less. I'd like to ask their advisor, Jessica Strickle, and the other Hope Squad members to stand and also let us thank you. You are truly making a difference in the lives of your fellow teens, and Dayton Children's is here for you in any way we can provide support. So as the construction begins below, it's going to be below, you're going to see it in a moment, we already are seeing what this is going to look like. We already have a vision. So I want to first thank those that are making that vision come to life: Dana's Construction, Champlin Architecture, and Cannon Design. These professionals have been with us every step of the way, and I want to thank them so much for their support. So what will this new center look like? What will be in it? What's most important is it will allow us to expand, combine, and integrate many of the services that we've already put in place that Dr. Blankenship spoke about. It will double the number of inpatient beds. And our hope is that we'll never again have to tell a parent or a child that we can't immediately care for their particular condition, their particular health issue, because we don't have a bed. I can't imagine any other condition, any other problem that a child would come to us for that we would have to say, you're gonna have to wait. So doubling the number of inpatient beds is critical. It will also allow us to bring together our crisis center and our intensive outpatient services so we can provide them in a more efficient way, and also expand our bridge therapy and psychiatry program so we can ensure that children going from one level of care to the next don't fall through those cracks. We'll have customized outdoor spaces because we know we all feel better when we're looking at the sunshine. And above all, it will be designed with the safety and comfort needs of children who are going through a mental health crisis or coming back for therapy. So at the same time, though, that crews are breaking ground right out here, we are also expanding our community-based therapy. Because again, as Dr. Blankenship said, we have to make sure there's places to continue the support that children receive once they leave our inpatient unit, or hopefully, in many cases, to support them in a way that requires them not to need an inpatient space. So we have just recently opened up outpatient therapy in Beaver Creek, and soon we'll be able to open up therapy in Huber Heights and in Troy. And we continue to look at where we need to add these therapy services throughout our community. This is not an inexpensive effort, as you can imagine. This project is an important part of a very comprehensive strategic plan that the Board of Trustees of Dayton Children's approved to address the mental health needs of our children. This part of this project, the building and the outpatient services, is $110 million. And it's through philanthropy and the generous and gracious support of this community that we are able to make this happen. Our chairs of our fundraising committee are here. We have Rob and Jane Conley and Tony Kenny and his wife Jean, who's not here, but they are actively working in the community together with our foundation staff, sharing the need and already raising funds to make it happen. And then our friends at CareSource. I think I saw Erhard Prater here, made a $2 million contribution to this effort. Again, we could not do it without this community's support. And finally, and not finally, of course, the heartfelt thanks to Governor DeWine and our local legislators who championed this project and supported a $25 million contribution of ARPA funds. We could not make this project possible without the support of the governor and our legislators. So with that, there is no bigger supporter, no committed supporter, no greater committed supporter to the mental health crisis and children's health care than Governor DeWine. So Governor, we'd be honored if you'd share some words with us.
Debbie, thank you very much. And to all of you who have contributed, thank you. Thank you for what you are doing. This is a great day for the children of the Miami Valley. I think that if anyone wonders why this is taking place, just listen to what Dr. Blankenship said. I think her comments kind of laid it out. That's sort of the why. Why do we need to do this? And so I thank her for her leadership and for her, certainly for her comments and for everyone else at Children's. We are blessed to have great children's hospitals in the state of Ohio. And those of us who live in the Miami Valley are really blessed to have Dayton Children's Hospital. Fran and I have on certainly more than one occasion been over here with children, and now we're seeing some of our grandchildren come over as well. And so we are just blessed. Some states have no children's hospitals. For us, we have them all over the state, and they're doing an absolutely phenomenal job, and Dayton Children's is just great. I want to congratulate Harper. Thank you for your leadership, for your comments. I want to thank the Hope Squad. Thank you all for what you do. The data clearly shows that the most effective people, it's no surprise, but the most effective people to talk to young people are young people. And they're the ones who know if there's something going on in the school. They're the ones who know if there's someone who is struggling. And it just makes sense. It's a model that really works. So thank you all for being part of it. Thank you for the leadership and for what you were doing. This step is another step forward in the state of Ohio to really fulfill a pledge that was made 60 years ago by the President of the United States, John Kennedy. About 3 weeks before he was killed, he signed the Community Mental Health Act. And in that bill, there was a pledge made by Congress on behalf of the American people and made by the President that we would build in this country a mental health system so that no family would have to be in a situation where they could not find a place for their loved one. No family would be in a place where there was a crisis with someone they loved and they couldn't get an answer. That was a commitment made 60 years ago. We as a country have not done it. But we started in the state right after I became governor, working very closely with members of the General Assembly. I see Andrea out here, and I'm kind of blinded. There may be other legislators out here. But we started very early. And one of the first things that we did was, in our first budget, is we set aside dollars to go to every school district in the state of Ohio. And we called them wellness dollars. And these wellness dollars could be used for mental health. And we've seen many of our schools take advantage of that, and I think it has truly made a difference. I presented a budget to the General Assembly that keeps this process moving. You can't build this system overnight, but we are committed to build it. It's just absolutely so very important. It's for adults, but it's also for children. Fran and I have had the chance to travel around the state and be in many, many schools. And when you talk to the superintendents, you talk to the principals, you talk to the teachers, what they will tell you is the number one challenge that they face is young people who have a mental health challenge and a mental health problem. It is something that is just hard to even describe or hard to even quantify, but it is there. What we are doing in the budget that we've requested the General Assembly to pass is focused on really four things. One is prevention. Two is crisis response and treatment. Three is the workforce. We don't have enough people in the field today, and we have to build that workforce. And four is innovation. We don't use enough innovation in the mental health system today. We don't do enough research. We have to do more. So these four component parts are what we see is how we really build this system in the state of Ohio. Again, thank you all, everyone who has played a major role in this. I thank the doctors and the nurses and the people at Dayton Children's. I can just tell you from our own experience many, many years ago with our daughter Anna, who was 6 weeks old, and we came over here, and it was just to see the doctors descend on our child and know that she was in the best hands possible. There's nothing that a parent is more important to a parent than to see that. So thank you, all of you, for what you do. Deborah, thank you for your leadership. One more great step this morning being made by Dayton Children's to serve the children in the Miami Valley. Thank you all very much.
Thank you, Governor. So you might wonder why we're having a groundbreaking, but we're 5 stories up high. But as you saw, our friends at Dana's have already been moving dirt because we can't waste a moment of time to get this building going. What we wanted to do today is to lend our support by asking our panelists here, our people here on the dais, to come and sign their support to help us bridge this gap for mental health. So at this point, we'd like to ask the governor and our First Lady, Dr. Blankenship and Harper, to join me over here, and we will sign our names and put them on the sign to pledge our support to bridge that gap.
Signing ceremony.
It's a signing ceremony, right. After we sign, we're asking you to go to the room to the left where you will see a bird's eye view of the new building.